I'm Jerad. I am Navajo and also Tlingit Alaskan. I am a LCSW therapist here at Warrior Rising. I am a clinical therapist outpatient here at Warrior Rising, fairly new. I'm getting adjusted, but I've been doing this for quite some time. I'm going to be working with individuals in the substance use population and demographic. Right now, just kind of getting acquainted, working with clients, building up caseload, doing assessments, and just essentially trying to help. Also, as NAT-SU is growing, I'm also helping in creating with their program and the process and trying to just get things a little bit more organized and situated. And naturally, with any program, as you grow and progress, things change and they have to change because they have to adapt. And so part of what I'm helping is facilitate and help that growth. Programs, curriculums, rules, policies. So it's been great. I love it. It's been nice kind of doing that as well as working with the clients individually, one-on-one. I think one of the great things is for Native males, I just went to a conference and I heard from other people who went to the same conference is that Native American men make up less than 0.1% of the LCSWs. I think one of the opportunities and neat things is working here is I'm one of the small percentage to be able to help a lot of the Native men and women who work here. And hopefully I'm a great role model and to exemplify those qualities and, in their lives and stuff. So with that, that's part of what I love doing here, being in a place where I can share my culture with evidence-based practices and helping them, finding new ways that hopefully helps them. And also at the same time, I feel like I learn just as much as they do in this process. Always trying to learn, definitely. Have a lot to learn from clients and from other of the staff people, so that's been super helpful. I think one of the things is I grew up on a Navajo reservation, and then I would move to the city. I just read an article which kind of makes my point by the ICYM, where they did a poll for the last 3 years, and 51% of Native Americans have shared a poor interaction or hesitancy in the healthcare settings. So what they were saying was because of that number, it was due to being in a healthcare setting where you were interacting with people that are not of your same race and cultural background, due to misunderstanding, lack of understanding of culture, and many other reasons. So growing up on a reservation, interacting with doctors, dentists, and people who were not Native American, and then moving to a city on the outskirts of the reservation where it was the exact same thing. Me, my family, friends, everybody in the community, we had those interactions. I always felt growing up it wasn't specifically this job, but I grew up I wish I'd be in a position where I could be that person to where I felt comfortable going to and not having those poor relations. In college, is where I kind of felt and understood I was first in psychology and got my undergrad in psychology. And then as I got farther and wanted to do my master's, I finally realized psychology isn't the field, it's social work, where I can be more case management as well as administrative, as well as policy and interacting with the clients on a hand-to-hand basis, individual face-to-face basis. So that's where I felt like I could do that, having the experience of living on a reservation, living off of it, being Native, but also not completely of one tribe. So I felt like I had a good understanding growing up traditional and then now living not completely so much by those traditions. And so I feel like it gave me a really good understanding and working and empathy towards Natives who come from either realm or world. In that meeting where I talked about that statistic of less than 1%, the other statistic they shared is Native American therapists make up less than 10% in the field. And then on top of it, within those with PhDs, because they're the ones who are the professors and raising the next generation, is that, I think it should be something highly considered so we can make those changes in our communities and be the ones to raise the next generations of whatever it may be, therapists, administrative assistants, case managers, nurses, whatever. So we can have better interactions and be a voice as we rise to leadership to make those and implement those changes in our workplace and in the fields. I think it's definitely something to look towards and to definitely consider If I can do it, I feel like anybody else could. And there's resources, I would say. Talk to somebody, come here, talk to me, or go to any other Native that you know. I know they're very happy to share. There's plenty of resources out there to do that. It just takes a lot of work and finding, and some of them are unknown. And so that's why it's nice to like reach out to somebody. And working here, I think it's great because having worked with the state, with AP&P and the prison and other residential and other programs, I think it's nice that there's a place where we can integrate our culture, our beliefs, our traditions with evidence-based practices while trying to help provide these services to Native Americans is a great, like you can't find that in very many places. And there's only 2 other places I know of in Salt Lake. And then even then they have limitations to their services. And I feel like this is an extension of that. So I think working between all 3 of us is a great help to Native Americans. And so that's what makes this place so great. And as we try to grow and help to outreach and provide those services to our fellow Natives.